Yeah. All right. Well, welcome to For the Caregiver. This is our 4th episode ever. I took a little hiatus because I was doing things like getting married and making babies and stuff. So here I am. We're back, and today I have with me Julie.
Yes.
You are you were up until just recently a pediatric heme-onc nurse.
Mm-hmm.
I want to get into that. I want to talk about that.
Yeah. So I passed the NCLEX in 2020. My first job was as a pediatric heme-onc nurse at a children's hospital. Started like right before COVID, like literally like 2 weeks before. And I did that for 2 years, and now I'm currently an adult heme-onc / infusion nurse at an outpatient center. Yeah.
Okay. What was it like starting work two weeks before COVID? What happened?
It was pretty normal. Like, you didn't have like the masks or anything, but we were like, getting like news like, oh, like there's like this virus, and but it was, we didn't really know what it was. And then
what month was that? March?
So I started in February.
Okay.
Like, I think I was like the last week of February was like my first day at work. And then I think like mid-March is when we started wearing like masks, and everything changed.
Yeah. You didn't, obviously, I don't think that children were too badly affected.
So like the first year was okay, because kids weren't as affected by the virus. It was actually pretty slow. Like, we had like a point where nurses had to take, I think, a week off without like getting paid in order for the hospital like to stay afloat, because we just weren't getting patients. Like, parents didn't want to bring their kids to the ER. Elective surgeries were canceled.
Right.
Even we weren't having as many patients, and kids still have cancer, so I don't really know where they were. Like, maybe parents weren't bringing them into the ED when they had to bring them. But
I love that you mentioned that, because that is a phenomenon that I think every specialty experienced. Like, I remember, so I was in the ER, I remember getting tons of COVID patients, but it's like, where are heart attacks? Where are the stroke patients?
Yeah.
Where is every other patient that normally comprises our day?
Yeah, it was like empty. And the fact that they had to like ask us not to work, we're just like, oh my God, like, what's going to happen?
Yeah.
But then a year passed, and then kids were getting it more. And then we started getting like COVID patients. I got lucky that because I was on an oncology floor, we weren't accepting COVID patients for a while, just because we didn't want to, what's
dirty,
it called?
Clean, kind of.
Right. It was hard, but you can still get floated to units that were taking those kids. And then after like a year, I think we started taking only like oncology COVID positive patients, but you could only have like COVID positive patients. So it was like hard, because sometimes you'd have like 3 or 4 kids, and no one wanted to like help you, because they're like, oh, I can't,
I can't, because they have COVID. And
yeah.
And they're trying to stay clean with the other chemo patients and stuff like that. Yeah. That's really interesting. But yeah, I don't know where all the normal patients went for like a good year. I remember like for 3 weeks, like our cath lab didn't do one intervention, like didn't have one patient.
Right.
Like, people just stopped having heart attacks. Like, people just stopped.
I just didn't want to come.
I don't know.
Yeah, I don't know.
That's going to be something like that. I'm always like, what the heck was that? Like, what was that?
Right.
Because at that point, our whole entire hospital was only COVID. Yeah. That's really interesting. So, okay. Even in the kids that you saw that had COVID, were they ever really sick, like severely sick, or?
Most of our kids were okay. I mean, I think if they were like really sick, they would go down to like the PICU. It wasn't too bad. It was more like upper respiratory, and then they were just stuck in the hospital for like 2 weeks. Like, they had to like quarantine in the hospital. And then it kind of sucked for the parents, because they couldn't, if they wanted to leave, they couldn't come back in. So they were stuck in that room with the child. So they'd have to like order all their food from like the cafeteria downstairs.
So at no point in the 2 weeks could a parent ever leave the room of the child and come back.
Right. So we did have like some kids, because it's so hard. And like in the population in DC, you know, there's a lot of poverty immigrants, and like those parents have to work.
Yeah.
So we had a lot of kids like where their parents were like, I have to go to work, or I have like kids and they need to be taken care of. So those kids would be like in the room by themselves for like 2 weeks.
Wow.
And they would just see like their nurses and like maybe the doctors or the residents. The doctors wouldn't really go in there. Yeah.
That's incredible.
I know. I felt bad for them.
That's ridiculous, actually.
Yeah, it was like really strict. So as soon as the parent left, they just couldn't come back in until like that quarantine was over.
Wow.
For the child. So
wow.
Yeah.
So that happened in 2021 by the time you guys were getting COVID?
Yeah. So I think it was like after that first year is when we started seeing like more kids getting it and our onc patients were getting it. So it was pretty normal.
They already like immunocompromised from having chemo and cancer and all that stuff. Yeah. That's really interesting. So I know you love where you're at now, which is exciting, and I'm so happy for you. And I definitely want to talk about that because I want to always nail home, like, if you are not okay in your current situation, you need to get into a different one. But I want to talk about what was difficult for you working for a hospital system, how it affected your mental health, how it affected every part of your life, basically, and why after, 2 years, you got out.
Right.
Yeah.
There's just so much.
Yeah, go for it.
Yeah. So I think like any new grad, like the first like 3-6 months, I feel like you're like in a little honeymoon phase in nursing, because you're like, oh, so I passed it. Yeah, like I passed an NCLEX, I'm giving out meds, like I'm doing all of this, like I'm learning all these, new stuff, and I'm like actually being a nurse. Like I'm not following a nurse around, like, during nursing school. So it was fun at first, and then it's like oncology and it's kids, so it's just really it's really sad, so you're just constantly like having kids that are newly diagnosed with cancer, or patients like dying, so that was like a big thing, just like always being surrounded by that. And then just like the stress of working in a hospital, like it's always the nurse's fault. Like, oh, why didn't this patient get their x-ray done? Or, oh, like, why didn't this get done? And I'm like, oh, it's not my, just, so that was hard.
Did you feel like you had fair nurse to patient ratios?
Yes.
Okay.
I think so. For the most part. There were, like, towards the end when we were getting, like, short staff, like, it would be pretty hard. Like, you'd have, like, 4 patients is a lot in, like, Peds onc.
For sure.
Because those kids get, like, a ton of medicine. And it was also, like, a transplant unit. So we would get those patients,
That's
too.
a ton of medicine. And you're not just dealing with a patient. You're dealing with a patient and their parents.
And their parents.
Yeah.
Which I think was, like, the hardest part.
For sure.
Of working in Peds is, like, the parents. Because, I mean, the kids are, a lot of them are young. Like, they're 6 months. They can't really, say, like, our youngest is, like, maybe, like, 2 weeks old. Like, that's, like, the youngest I've seen on
with
that.
Cancer.
Yeah. Yeah.
Wow.
Yeah.
That's devastating. Like, that is a huge emotional toll.
Right.
Like, that, like, you're witnessing on a weekly basis the hardest thing that a family will ever go through.
Right. And you're doing that, like, every single day.
Right.
Like, you're always getting, like, bad news. And that's, like, I think that's why people say, like, oh, like, when I would tell them, like, oh, I'm, like, a Peds, like, hemonc nurse, they're like, oh, my God, your job's so sad. Like, why would you do that? And even before taking the job, like, I had a lot of people telling me, like, oh, why don't you do something, like, happier? Because I got, like, a job offer to be an L&D nurse, which I thought I wanted to do. But then I got into Peds, like, for clinicals, and I was like, oh, no, like, I want to do Peds. But I think it's because, like, the lows in Peds hemonc are, like, really low. Yeah. But then the highs are, like, really high. So it's just your emotions are always, like, going.
How did you cope with that? Like, what do you feel like? What coping mechanisms do you feel like you picked up that were actually beneficial for you? What wasn't beneficial for you?
And I think that's like COVID made it hard. And I think that's why I got so burnt out like so quick. Is like there wasn't much to do. Like you were like, especially in the beginning, like when we were being like really strict with like not going out and wearing mask, everything was closed. I think I felt like kind of like stuck because I was like, oh, I'm going to work and it's really sad, and then I have to go home and I can't be with my friends. There's no way, the gyms were closed. Like that's my way to de-stress is the gym. And that was closed. So,
shout out to her fitness page. Yeah. What is it?
At Julissa_C.
At Julissa_C.
Yeah.
Okay. She has a lot of great content on there. Home workouts for the gym, lots of stuff. If you got like dumbbells or kettlebells, you can follow one of her workout plans. It's amazing.
Oh, thank you.
Do it.
Oh yeah. But so I feel like the first year there wasn't much that I had to like a way to cope with it. So I just felt like it was like an endless cycle. I was just like, oh, I'm at work, I'm at home, I'm at work, I'm at home.
Imagine like your first year in a career and you already feel kind of hopeless in it.
Right. Yeah. And so I think at like my year mark, and like I said, it was like a mixture of things. I was just like tired all the time because we would switch from day and night shift. My commute was really long. Like on a good day without traffic, it was like 45 minutes. But usually it was like over an hour. So imagine driving that after like a night shift.
Yeah.
And
you can like barely keep your eyes open.
Right.
Yeah.
Right. So I just got to a point where I'm just like, I don't even know if I want to be a nurse. Because I just felt so stuck.
Within a year.
Yeah, within my year.
Yeah.
Like I was already looking for like jobs or like career switches. I was like, oh, maybe I can go to like IT. But like nursing's my second degree. So I was like, I can't. I was like, did I really spend all that money and time?
Right.
And not use it. So I was like, but it's hard to get a job with only 1 year of experience. Like after, like they want you to have at least like 2. But at my year mark, I was like, okay, like I'm just going to make it to like my 2 years and then I'll start looking for something else. Like I was like, you are not going to be at the hospital at 2 years because I was just over it.
Yeah.
And then it happened.
What happened?
I got a new job.
Yay!
Outpatient.
That's exciting.
Yeah.
That's literally exciting. So what did you feel like the hospital system offered you in terms of support?
I mean, we had like those little chaplains that would come and we'd have like, I think it was like once a week. It was like a de-stressor, like at the end of the shift. But if you were really busy and like drowning, like you couldn't go to that.
Yeah.
So you missed it. So there wasn't much. And then we lost like a lot of patients like the last year I was there. And, no one really
lost them. Like they died?
Yeah.
They passed away?
Yeah. Yeah.
How does that work in a pediatric oncology unit? Do they go out in codes? Do they go out peacefully?
It's different. That's like the hard thing with kids is they can tank like really fast.
They compensate till they don't.
Right.
Yeah.
They're really good at compensating and then they just like tank like out of nowhere.
Yeah.
Like they were fine like at the beginning of the shift and then they're like you're rushing them into like the PICU at like 7:30.
Yeah.
So I don't know. I'd say like there was a mix. Like most of them, I don't think we ever had, at least when I was working there, no one like passed away like during a code. Like we'd always get into the PICU before that happened.
Yeah.
But I think that just comes with like the nurses that worked there and like the providers. Like we were all really good at what's it called? Advocating for them, escalating things like when we needed to. And then a lot of them would pass away at home and we'd always get emails. They're like called the angel wings. And you'd get an email saying like, oh, so-and-so passed away on this day. And it would be hard because like a lot of those kids you thought that like, oh, they're home, they're okay. Because we don't really get updates like once they leave.
Right.
And then they pass away and you're like, oh my God. And then some would be like end of life. Like parents would decide to just keep them on our unit. And we would just keep them comfortable until they passed. So that was really hard when you're like the nurse.
Yes.
Or the nurse like leading up to the day that they passed. It was like a combo, but.
That is a lot to carry. That is a lot to carry.
Yeah.
How are you? Like how?
You definitely have guilt. I think it's better now that I'm in the outpatient setting. We don't get that news as, especially with like, I work with adults now. I don't work with kids.
What guilt do you have?
So when I was working with kids, I think it was more like just feeling guilt that it didn't work. Like, I know it's not my fault or like the doctor's fault that the chemo didn't work, but you have that guilt that it didn't. And it's hard to explain. Yeah. You know, because you're the one that's hanging up that chemo and you're seeing like those parents, like, especially the ones that are like religious, you know, you have all these cultures just like praying, like as you're like putting up the chemo. Yeah. And, you know, they're hoping that it's going to like work. And then it doesn't. And then chemo causes a lot of complications. And sometimes they'll die from like the complications of the chemo, not even the cancer. The cancer itself. Yeah. Yeah. So I don't really know where that guilt stems from, but you just feel like every time a patient passed away, I was just like, I'm sorry we didn't do enough for you. Even though we did everything, like we gave them all the treatments that we had. And it just didn't work for a lot of kids. So experiencing that day after day, month after month for like 2 years. 2 years. How do you feel like that it's affected your life in other places? Like, how did you cope? I mean, like some people build walls. Some people say like, look, I'm not going to stay here for 15 years. I'm going to get out after 2 and do something. But like, how did you get through it? Like, what did you use to get through it? I bottle things up. So I don't think I did a very good job at like expressing like when I needed like just like a shoulder to cry on, or especially like when your family, they don't work in, because I live with my mom and my sister. And they would never want to talk about that, which I get. Like, they don't want to hear about like a child passing away, and I could talk about it with like my coworkers, but like we're going through the same thing too. Right. The same thing. So we couldn't really help each other. Right. So I think and your coworker isn't your mom. Right. Isn't your support system. Right. Isn't your significant other. Exactly. Isn't the person or a person in your life that you really know and trust and necessarily like, like we'll talk at work, but you know, we're not breaking down and crying on each other's shoulders and stuff. Yeah. And not to say that my mom and, you know, they weren't there, but they just didn't get it, if that makes sense. Yeah. And that's hard. It makes it feel like this thing that's so real for you, this thing that's so like alive in you, is just a story to them. Right. Because they didn't get to know like the patients. Because we got to know like our patients like so well. Especially like the little ones that, like I said, like their parents had to go to work and all of that. So you're pretty much like their caregiver, like their parent in a sense, like in the hospital. Like I'd have some kids that I'd be watching movies with them at night if I worked like night shift, or like reading them books, or ordering them their food, or giving them their baths, you know. So you get close to them, you get attached. Like it's hard to like keep those boundaries. Yeah, especially with kids. I can see how it would be easier with adults, but kids, man. Yeah. So I think that definitely was like a factor. Like I just didn't cope with it like super well. Yeah. I think you're the first person we brought on that's done peds. Really? Yeah. And I don't have a lot of experience with peds outside of the ER, which has been a like I've had a handful of really sad cases. But there's something about kids that makes it, not that adults aren't important, but it is. It's something about kids that is sacred. Like yeah. Because like now I have like the adult onc experience and the ped onc experience, and I mean, like you said, cancer's sad.
Right.
Like, no matter who it affects.
Yep.
But at least with, like, adults, like, they've been able to live their life, you know, for most of them. They've had, like, a full life. And then kids, like I said, the youngest patient I've seen there was, like, 2 weeks old.
Yeah.
You know, parents didn't even know that he was going to be born with.
It's like you're grieving for the kid, you're grieving for the parent, you're grieving for yourself. Right. You're experiencing grief on a lot of different levels. Yeah. Repeatedly.
Like every shift. Even if a patient didn't pass away on your shift, like I would be in rooms when doctors would come in and tell them, like, oh, treatment's not working. There's nothing we can do, or, oh, the cancer's back. We have to do another round of chemo or another transplant. So it was a lot.
That is a lot. So in, like, bottling things up, do you feel like you're going to be able to have longevity in this career, and still stay compassionate? Because I feel like for me, like, I've been a nurse for 13 years now, and this is like a challenge of where I'm at, and we talk about, like, PTSD and secondary trauma on here a lot, but, like, how do you build into your lifestyle resilience in a way that you come out okay and you don't lose your compassion for the people that you're serving? Right. Like, the last thing a parent of a kid with a new cancer diagnosis needs is a provider of any kind that doesn't care, that doesn't have compassion, that doesn't. Did you see any of that? Like, were there salty seasoned nurses that are just kind of like, it is what it is?
I don't know. And I don't know if it's because it's, like, peds and they all just really loved the kids. I mean, you would hear things, like, out of, like, the patient rooms, like, but I think it's just nurses complaining. But I don't think I ever saw a provider, or, like, at least on my unit, that just didn't care. Yeah.
That's good. That's good. Yeah. It's a tough thing to stay in emotionally.
Right. Yeah. I would work with nurses on that unit that had been on that unit for, like, 20 plus years. And like, not even a year, I was like, oh my God, I cannot be working here. Like, I already knew, like, it was just too much.
That's good, though. It's good to have that awareness, because I feel like in nursing there are so many, like, options.
Right.
There's so many different avenues you can take. You don't have to feel. I remember working on a telemetry unit and thinking, like, I am done being a nurse. And then I went to ICU for, like, a couple years, and it kind of renewed my, like, oh, okay.
Yeah.
Now I feel like I'm back in a place where I'm done being a nurse, but we'll see. Why? I think I just need time off. I think what I want to do is finish my NP.
Oh yeah,
I started in psych. Yeah. And I definitely want to finish that. I'm not sure what I want to do entirely with it, but I know for me, like, 13 years, I became a CNA when I was, like, 16. Sorry. When I was 16, and now I'm 34.
Oh my gosh.
So I've been literally, like, years. Yeah, I've been wiping asses for, like, 19 years, babe. Like, that's a long time. Oh my That's a long time to be wiping asses and just caring for sick people.
Right. Like emotionally, physically.
Physically, emotionally. Like, I definitely know that I can't do bedside nursing anymore. I definitely know that. So I need to, like, fall back, finish school, and just kind of, yeah.
Come work with me.
Come work with me at Kaiser.
Right.
So you do outpatient, you do Kaiser. A lot of people have a lot of employees that I've talked to that work for Kaiser are very satisfied with working for Kaiser.
Right.
What do you think the difference is? What do you think makes that so much? I mean, aside from the fact that peds versus adults,
right?
But in terms of organizational structure, what do you think is so much better about working for Kaiser versus a healthcare system?
I mean, I think the big thing is, like, it's out. Well, at least here, out in the East Coast.
That's where we are.
Yeah, that's where we are.
You'll never know.
It's outpatient versus inpatient. But I don't really, like, I work with doctors there because, like, we have oncologists and they, like, see their patients for, like, follow-ups, like, in the front of, like, our office. But in the back, it's just, like, nurses, like, running. I mean, it's kind of like a unit where nurses are doing everything. But there's, like, a lot of like autonomy. Like I get to like assess and like not determine if they get like their chemo, but for the most part they're just seeing us.
I see.
Yeah. And we
so
put
you like that?
Yes, kind of. I don't need to be like in an authoritative role. Like
no, but I know what you mean.
You know, like calling all the shots, but it's nice
to have some autonomy in your practice. Yeah.
Yeah, and I really don't have to like talk to the providers unless something's something's wrong. Like, they had a reaction or they have like a question that only the provider can answer. Yeah, and then management, we don't really see our manager that much, which I don't know if that's like a great thing. She like manages a bunch of like other offices.
Yeah.
But I don't know. Like it's like a healthier environment, I think. And I don't know if it's like the nurses are older. Cause on my other, like where I worked with Peds, it's like all a bunch of like 20-year-olds, which can be a little catty.
Yeah.
Yeah.
Yeah. I feel like sometimes I was precepting a new grad last week. And it was just like they wanted to just show me how much they knew. And I was like, that's cool.
Yeah.
It was weird. It was just weird. I was just like, bro, like chill. Like let's just you gotta learn some stuff and whatever. Like I know you're smart, you're here, like that's cool. Like relax. But yeah, amongst girls it can get like strange.
And I think that was also like a thing on my old unit. And I didn't leave for that, but we had a lot of nurses that did leave because of that. Because it's like really like cliquey and people aren't as welcoming and
strange.
Yeah.
It's strange. That is a dynamic across, I feel like.
I think any unit you go on to. Any unit,
it's just nursing. Like that's an issue in nursing. And I feel like sometimes we as a profession, we go through so much because we can't for like 5 seconds get united and be like, yeah, no, we're not going to do this. Because like I know in Colorado, I was reading about these in Missouri and these travel nurses that were getting paid, what's it called? Strike pay. Okay. So hospital systems had gone on strike, and a huge percentage of their nurses walked out. So these travel nurses came in, they were getting strike pay. And the nurses that remained as staff nurses that didn't leave in the strike were like literally sabotaging. They were literally changing drip rates in ICU.
What?
Just to make another nurse look bad, like putting a patient's life in jeopardy to make another nurse look bad because they were jealous that they were making like $9,000 a week.
They were doing that to the travel
nurses. They were doing that to the travel nurses. Oh. And I'm like, this is like why we as a profession can't just collectively rise up and be like, hey, like, we should all be paid really well. You know, we should all, but we're so too busy like amongst ourselves.
Fighting each other instead of working together to, you know.
Yeah, it's really strange. Like, it's really strange. Like, the issue is not us. It's the healthcare systems that we're put into. Yeah. Yeah. They literally, like, overturned a bus. A bus was driving with some travel nurses in it. Like, physically overturned the bus. It's really strange stuff.
If you want to make the money, go be a travel nurse.
Travel. You could have left on strike.
Right.
Like, so strange. I do think we struggle with that as a profession, getting united and getting kind of catty. And I'm not sure why. Like, I'm not sure why.
I don't know.
I don't know what that is for
I don't know if it's just like... It's like heavily like female dominant. I don't
that, and I don't know. Seeing some pretty spicy male nurses as well.
That's true. Yeah.
I think it's the stress of the environment too.
Maybe
it lends to like bringing out the worst in people, and I think nursing has created such a punitive culture around mistakes, around whatever, and so we all like don't want to be seen as that person. So what's the easiest way to not be seen as something is projected onto someone else, you know, like, and so I think the healthcare has created this culture within nursing that's very like blame shifting because we don't take mistakes and necessarily learn from them as a healthcare system. We take nurses and put them into the judicial system and charge them criminally for making a mistake. Right. And so I think what drives a lot of that cattiness is just a fear, an underlying fear of making mistakes, of being seen as making mistakes or whatever.
Yeah.
I don't know. There's always like this flex of like, I'm smart.
Right. Yeah. Just like know it all.
Why? That scares me.
Yeah.
Because you don't know what you don't know.
Right.
Yeah.
And I don't know, I feel like that like leads to mistakes.
Exactly.
Instead of like asking for help.
Exactly. That could literally kill somebody.
Right. Right.
You don't know what
I'd rather
know.
ask and look dumb than hurt someone. So
which is how like we should feel. Yeah. Okay. You are in a new relationship.
Yeah.
Yay.
Kind of. It's been like a year.
It's been a year?
Yeah.
It's not that new.
It's not, but
especially compared to my life. My story. I'll tell my story one day. I'm not ready yet. Yeah, I feel like the last podcast I did, I was literally talking about dating. And now I'm married and about to have a baby.
Wow.
Lots happened, you guys. A lot has happened. So do you feel like some of the trauma that you've experienced in your profession has made it challenging in your romantic relationship?
I don't know.
Okay.
I don't think, like, I definitely don't open, like I said, I like bottle things up. So I guess I just don't, I don't know. He's pretty good at like asking like, how was your shift and how are you feeling? But he doesn't get it like completely, but he's there.
That's nice.
Yeah.
That's helpful.
Right. Yeah. I don't know. I don't think.
Okay.
I'm sure it has. And I just don't know that it's affecting something in my relationship.
I feel like that's how trauma is. Like we just carry stuff and we're like all unaware of it. And it's just, we're affecting our lives.
Right.
And we're kind of
just don't know that it's affecting it.
Yeah.
Yeah.
That's interesting.
Well, now I'm going to be thinking about that. Is it affecting my relationship?
Could look at it. It's just something to consider.
Right.
Has it made you a little apprehensive to have kids?
I mean, I want to have kids, but I get scared. Like the baby that was born with, a tumor. They didn't see it. And then just being exposed to that chemo all the time. Like we wear like, protective gear, like double gloves, gowns, all of that.
Yeah.
But
I didn't even think about that part.
Yeah. Yeah.
Yeah.
Dude, it's
the biohazard.
Well, that, and I'm not exposed to like bodily fluids as much outpatient than I was inpatient. But I mean, it's excreted through like throw up, pee, poop, all of that.
Yeah, all the stuff that you're constantly cleaning up.
And with little kids, like you're cleaning their diapers, they're throwing up on you, you're dipping their urine, like doing like UAs and stuff, So I do have that fear that maybe either I'll get it like down the road, like some type of cancer from being exposed, or my kid. I think I'll feel worse if my kids get it, because it was my fault, because I was working with kids with cancer or adults with cancer. So
So interesting.
So sometimes I'm like, maybe I should leave oncology before I get pregnant, whenever that happens. But I don't know.
Yeah, that's interesting.
But no, I do think about that. I want to have kids, but I don't like, that fear is in my head. Because then I think, I guess you get not paranoid, but kind of. Because like, you're like, oh my gosh.
You constantly see the worst case scenario.
Right. So I'm just like, oh my gosh, they have this going on.
Right.
It must be cancer.
Right.
Their labs are weird. They must have, you know what I mean? And it's like nothing.
Right.
But
you constantly see the worst. Like I had a patient a few weeks ago. She came in. She's like, I don't know, in her 40s. She had diarrhea for 3 days. That was her chief complaint. Okay. Diarrhea times 3 days.
Okay.
She came in to get rehydrated. She's like, I don't know what it is, some stomach bug or whatever. I just want fluids.
Right.
I'll feel better.
Yeah.
We're like, let's just scan your belly. Make sure you don't have like an ileus or a small bowel obstruction or whatever. She has lymphoma in every organ of her body. Liver, everything. She has metastatic lymphoma. And that's the worst case scenario when your chief complaint is diarrhea. Right. And then you find out you have terminal cancer and your whole life changes. So it's hard not to bring that mindset into every other place of your life.
Right. Because I'll have like a little thing, like a little thing.
Right. Some small pain or something.
Right. Like something or something's just being weird. And I'm just like, oh my God, I have cancer. Like I must have cancer. And everyone's just like, you don't have cancer. And I don't.
And you don't.
But that's like where my mind goes.
It literally is.
Yeah.
It literally is.
Yeah.
And I think like when you think about neurons, you think about the brain, you think about how neurons fire in the pathway of least resistance. You know, you're in an environment where time and time again, what's confirmed in your brain is the worst case scenario. I think that can trickle into anything. Right. Like, doesn't even have to be bodily, can be relationally, it can be like whatever. If your brain is in the pattern of worst case scenario, then you kind of automatically think worst case scenario.
Okay, well now yeah, you're right.
Is that making sense? Yeah. So I'll ask you again. Do you feel like this career has made it difficult to have a relationship?
Okay, yeah, maybe like worst case scenario. Especially in the beginning, because they're just like, oh my God, they haven't texted me. Like, they must not, they're not going to talk to me ever again. But that might be,
It's the way our brain is set up to expect the worst.
Right. Yeah. Oh, wow.
It's incredible how I see it in my life all the time. Yeah. Brian always tells me, like, he's like, if there's a cliff, you're going to jump off of it. Like, he's like, you jump to conclusions. Like, you just, like, go, like, this happened, so this must mean that. And he's like, what? Oh. Yeah. Yeah. It's funny. Yeah. It's funny, but it's not. And I think it's really hard to keep the mindset that you need to have at work and not use that same mindset in other places where it's like actually not benefiting you, you know? But we do it in a protective way because it's like, okay, at least I saw it coming. Like, at least I saw that coming. Yeah. I don't know. I think we do it to avoid shock and sadness and
like, it's just to protect yourself, like a defense mechanism.
Yeah. Yeah. So that's, I don't know. Yeah. I know when my kids were younger, like I just could not have a baby patient. Like I just couldn't. I can't.
That's like what a lot of like nurses in my old job, like who had kids, they're just like, it's so hard. Yeah, it's just so hard. And I remember one of them, we had this one patient that we were so close to, like, because again, her parents had to go to work and she just was always in the hospital, always by herself. So you just got so...
How old was she?
She was... I think she was like 3, like when she first came to us. And then she turned 4. Wow. She passed away last October. Wow. I think it was like my hardest, like, patient, like, experience, like losing her. But this nurse, like when we found out that, because she was going to get like a trial and she just wasn't going to be able to make it through the trial because she was just so sick. My coworker, she was like, I can't take care of her. Like she asked like the charge nurses, like I know it's like not selfish. She's like, I want to be there for her, but I can't because it's just too much. I think of like my daughters, like when I'm with her. And she was going to pass soon. So, yeah. So, yeah, there were a lot of nurses said that it was...
Yeah. The more relatable it is, too.
Right.
Yeah. I have another friend named Julie, actually. Yeah. She works in neonatal ICU. Oh, yeah. Like preemie babies.
Yeah.
Oh, my God. She literally, for years, like 5-6 years... doing night shift all the time, loved it. Won like so many awards. Every patient's family would like write letters to the hospital about how amazing she was. Like it was her thing. Right. Like she was so good. She just loved the babies and just not timid about it. It didn't like, it just was like her. And then she got pregnant. She was out of there so really fast. She was like, no, I can't because now it's relatable. now it's something that I can, this could actually be me.
Right.
And it makes it different.
Right. And we had nurses, like, they would come back and their kids had cancer.
God.
Yeah. So I'm just like, ugh.
Does it make you wonder, like, if it was because they were
right,
exposed
a lot of us,
to stuff?
I mean, there's studies that show, like, they find, like, chemo traces in, like, nurses' urine. I don't know how it gets in it, you know.
Because you're just around it.
Well, you're around it. And I mean, we try to be careful. Like, we don't put, like, the chemo bags, like, out in the nurse's station. But, like, you know, you're touching stuff in the room and...
You're never 100% anything. Right. Yeah.
Right. So we had, like, quite a few. I think when I was there were, like, 3 of them who had, like, newly diagnosed kids with cancer. Wow. Yeah. Yeah.
That is tough. That would be scary. I didn't know that. But I really have, like, I've not done mother baby, labor and delivery, or anything to do with, like, hemo-onc. I've done ortho. I've done ICU. I've done ER. I've done, you know, all the step-down units in the world, med surg, everything. But that stuff, that world, the pediatric oncology, the clean world, I have not ever, like, I have no firsthand understanding of any of that. Yeah. It's fascinating. I did not even think about, like, the ER that I'm in now. I'm traveling, guys, by the way. I'll give you a life update someday.
Oh, you're traveling?
Yeah.
Oh. Yeah. I almost did that before I got this job.
Yeah.
Yeah.
I mean, it's the same bullshit at every facility you go to.
Right.
All the staff have the same complaints.
Yeah.
Nobody feels supported. Nobody feels... upper management will come... The CEO of the hospital will come down and be like, what do you think we need to do better? And it's the same bullshit.
Right.
Literally... Every location, people are saying the same things.
But they don't change it.
They don't change it. The patients are having the same complaints. Why did I just have to wait 6 hours in the waiting room? I'm like, well, the hospital 2 blocks down from here, their average wait time is 11 hours to even be seen by a provider. This is how people die in the ER waiting rooms. Right. But, you know, you got people, like, pooping on the floor, and ER is wild.
I could never do that.
It's a rodeo.
I did, like, I think our clinical, there was one, we had a Peds clinical, but there was no Peds patient. There were no Peds patients. So they would just send us out to, like, the Peds ED or, like, adult ED, and they sent me there one day, and I was like, I'm never doing that.
Really?
It was gross. I'm sorry.
It's so gross. Thank you for saying that. It's so gross.
It's like, and you just see everything.
Oh, literally everything. Everything you never wanted to see or didn't care to ever.
Like bugs. Like bugs was my thing. I was just
bed bugs, scabies. This is bothering me. Oh. My OCD is in full effect. The wire was on this side. It was coming across.
But yeah, I don't know how you do it because I can't do the ED.
I used to love it. I used to love the chaos of it. I remember when I first started in the ER, and I was like, this is it. I could do this for the rest of my life. Yeah. I don't want to do that for the rest of my life. It does. You get to a place where you're like, I've seen it all. And even if I haven't seen that specific thing, I've seen some variation of it. And I'm just like, I'm not impressed anymore. Like, I'm just not, like, it could be the coolest code ever. You're cutting somebody's legs open, starting ECMO. And I'm like, yeah, I'm just not interested. Like, I'm just not here for this. Like, I don't know. And that's how I know I need to fall back a little bit. I am super interested in psych. And what I'm super interested in is healthcare providers being mentally healthy and healthcare providers not tolerating what healthcare systems have put them through at the front lines of their basically for-profit organizations, and the subsequent effects that has on us and the patient. Like, nobody is really benefiting from our healthcare system. Truly. No. I think we're like 46, ranked 46 in like worldwide of like
the U.S.
The U.S. is ranked like for worldwide in like effective healthcare, and we have the most money on the planet.
Yeah, we don't spend it appropriate
here. We don't spend it on this, you know. So, yeah, I think for me that's like I'll literally talk to doctors and nurses and providers on a daily basis, and we like kind of joke but not really joke about being like passively suicidal or passively just like you know, like we'll be like, oh, it's dark, and a doctor will be like, as dark as my soul, as cold as my soul, or something, like, you know, and you're just like, yeah, we kind of mean that though.
Yeah.
You know?
Yeah. There's some truth.
There's a lot of truth.
Yeah.
Yeah. And so it's like, knowing that I'm passionate about that, I'm like, I just gotta move toward what I'm passionate about. And I love that at a time of my life I was passionate about the ER. Mm-hmm. You were passionate about Peds oncology.
For very short.
That's okay.
Like, I don't hate Peds oncology.
Of course.
Right? It was just, I think it was the hospital. The hospital is just not for me. Like, there was no work-life balance.
Tell me about it. Talk to me about it. What was it?
It was just everything.
I know they made you do rotating shifts.
Oh, yeah. So, yeah, just rotating shifts. I told you I'd work like a day shift. Like, today I'd work a day shift. Tomorrow I'd work a night shift. And then I'd have a day off. And then I'd have to come back for like another. There was just never.
You can't catch up.
Right. And I didn't realize like how tired I was until I left. And I started this new job. And I was like, wow, I have so much more energy. Like, I can actually like work out and
do
function.
Things. Yeah.
Like, I'm not tired all the time. Like, I'd be running on like maybe 3-4 hours of sleep before like each shift because I just couldn't sleep because my body was just like, what are you doing?
Right.
You know?
Are we awake? Are we asleep right now?
Right.
And I also notice like on the nights before I have to work,
mm-hmm.
Shit, I have to work tomorrow.
Oh,
I just thought of that. Like, it's harder for me to sleep. I'm nervous.
Oh, yeah.
Like, I'm nervous. And I thought, I was, like, for a while, I thought, like, it was just me. Like, I thought, like, I just don't cope well, and everybody else is doing okay. When you start to talk to your coworkers, mm-hmm. like, even the physicians in the ER, they'll be like, oh, wait, what's up? And they're like, oh, I'm so exhausted. I only got, like, 3-4 hours of sleep because he literally said because I was scared about coming to work. Like, it's sad.
Yeah.
It's sad. And then you get there and every day is just like sad. Some sort of shit
it's
show.
True.
Yeah.
Like for a while, especially like being a new grad. Like the first like 6 months.
Shocking.
I was like, oh my gosh. Like what I would pray before I'd come into work, like on my little 45-hour-minute commute.
Yeah.
I would just be like, when am I going to get today? Are my kids going to be stable? Or is anyone going to code? I would get nervous about rounds because we had like, you know, you'd have to talk in front of all these doctors mm-hmm. and some of them were very condescending.
Yep. Yeah.
It was the NPs that were a little bit more condescending.
Yeah. What is that?
Unit.
What the frick is that?
Right.
Like as if 2 years ago you weren't a bedside nurse yourself.
Right. I was just like, you were literally.
Yeah. NPs, if you're listening, stop being a little cunt. Stop doing that. It's not helping anybody. It's not. You're smart. Just take this affirmation. You are smart. We all know it. You're good. You have nothing to prove during rounds in ICU or anywhere else.
Right.
Stop that. Anyway, sorry.
No, you're fine. No, it's true.
That's a public service announcement. Stop
all
that
NPs
shit.
Out there.
Yes. And for the ones that aren't, thank you. We love you.
Thank
we
you.
Appreciate you. We see you as well. Okay.
But yeah, I think it was like the first 6 months. It was like that. Like I would just get so anxious about work. And then eventually it kind of went away and I was just like, it is what it is. Mm-hmm. Like it's going to happen. Mm-hmm. But then it kind of came back like once it wasn't like anxiety towards the end, like that last year. It was more like dread of going to work. Just like, I don't want to be here. And it wasn't the kids. Like once I got to work, like it was not fine, but I was like 100% there. Like I was there for the patients, but I just hated going into work. And I was like, I don't want to feel like this.
Yeah.
You know, because I'm spending like 36 plus hours a week here.
Right.
I should, you know, be enjoying it and looking.
Stressful hours a week. Like,
yeah.
Really the best of you. You bring like the most of you, emotionally, physically, everything. You're bringing the most of yourself to that. Yeah. Yeah. It's tough. It is tough. And then you feel like the rest of your life is getting whatever's left over.
Right.
Yeah.
Yeah. Because then you just don't have energy to do anything. Or you're just preparing yourself to go back. Yeah. You're like, oh, I just did 3 shifts. I have like a few days off. But you're thinking about like, what's the next shift going to be like? You know what I mean?
Right. If you work like a couple or 3 shifts in a row, and then you have 3 days off. Well, the first day is nothing.
Right.
Because you're exhausted.
Sleeping or exhausted.
You're just like a zombie.
Right.
And I really do feel like a lot of it it's not just physical exhaustion.
It's mental.
Yes.
Right. Yeah. And that, it's
like
mental.
That need to like, I have been emotionally available to other people's crises for 3 days straight.
Right.
I just need to check out.
Right. But then it's hard because then you're thinking, you're thinking about your patient. You're just like, oh, I wonder how they're doing. Like,
did I remember to do this?
Right. Did I do something? That? Yeah. Could I have done more? I literally called up
in the middle of the night, like 3 a.m. Like, hey, I think I forgot to acknowledge this order about blah, blah, blah. Like,
right. No,
it's crazy.
I would text like my coworkers and be like, oh, don't forget. Not don't forget, but like, oh, just this, and this. I forgot to tell you this in a report. And, you know, I'm like, girl, I should be sleeping.
Right.
Instead of,
Right. And I feel like there's 2 ways to deal with that. Like, you hear those nurses that are like that. And then there's nurses that get to the place, like this one girl I work with, she's, bless her heart. She will, I don't know how, like the shift is 7 to 7. Somehow, something happens if she ends up staying until 9, being involved in something. So there's like that approach, like that is like, I'm like, okay.
Just leave, go home.
You care a little bit too much.
Right.
If I don't know if there's any such thing.
Yeah.
But then there's like other people that are like, it is 7:01, F this place, I am out. Like, and will not think another thought about their shift, like are able to like
break. I wish I was like that when I worked in the hospital. Yeah,
it just takes a while. I think it takes a while. I think 13 years later, I'm like, I don't care what happens when I leave. Not that I don't care what happens to the patients, but I don't think about it. Like,
right. You're just like, okay, I did my job. I did my best.
Right.
Let me live my life now,
But I don't think we do. I think we carry little pockets of things. Like that lady with 3 days diarrhea and then she has cancer. I'm like, I've thought about that multiple times since then.
Right. I mean, I still think about like the patients I've lost and the ones that are still at children or even my patients now, the adults. Yeah. Like thinking about them.
Yeah.
Because sometimes we don't see them for like a few weeks until they come back for the chemo again. Right. You're just like, oh, I wonder how she's doing. How did her scan go?
Right.
Is she going to come? Is she going to do the trial?
Right.
Like, just always thinking about them.
Yeah. It's true. It's true. And I feel like, I don't know if other people experience, I mean, I'm sure that other people experience, like if you work at Lowe's, you're not thinking about your customer later on. Like, what if they ever found that piece of lumber? Like, you know what I mean? Right. Like, I don't know if there's that, but even if they do, it doesn't carry the same like weight. Yeah.
Right.
Yeah. And I think that's what makes healthcare so traumatic to be in lifelong. Lifelong, yeah.
Yeah, I don't get how they do it for so long. Like, I work with nurses that have been in oncology for like 40 years. And I'm just like, oh my God.
Yeah.
Like, I don't know if I'll do it for that long.
I need to be talking to them. Like, what are y'all doing?
Right.
How are you okay?
Right. Because I'm just like, in my 2.5 years, I feel like I've experienced so much loss. I'm just like, okay, multiply that by 20 years. Right. Like,
that's so interesting. 2 years in. That's so interesting. But yeah, so I think talking about it is the first step with people that can relate, that can understand. And then just kind of, do you do therapy? Do you go to therapy?
No. I've been wanting to. Yeah. I've been pushing it. Yeah, I need to.
I feel like stuff could come up there, you know?
Yeah. Like I talked to my cousin Stephanie, and she does like a social worker.
Steph.
Hey, Steph. I'll make her listen to this. And I talked to her, and she just like unravels things, and she's like, "This is why you need therapy." And I'm like, "Okay."
Yeah.
But I just don't make time for it.
Yeah. Yeah.
But
I feel like too, there's always been like this thing in our culture that's like, at least in the ER, it's like somebody will, pass away in a code or come in, whatever, right. It's like whatever, or their CPR, does anybody object to ending this code? And there's like this kind of callousness that's like expected. This kind of like, well, room 13 needs a turkey sandwich now, so I'm gonna go get that, And it's kind of like almost like a complete dismissal over the fact that we're humans. What we just experienced was sad. Hearing the family members crying and wailing is like somehow not supposed to affect us. Like there's this expectation of like, you don't get to have emotions about this. Right.
And I mean, that's like the hard part, I think, like inpatient, like when you have like those patients that they don't do like one-to-one, like when you have like an end-of-life patient, like you'll still have like we would have like other patients. They'd be a little bit easier, but like you'd have your patient and they pass away. The nurse is the one to put them in their little bag.
Yeah. Jesus.
And then you have to take them down to the morgue. And then when you come back up, like your patient needs this med, or they want you to order them this food, Yeah. You don't have like a moment to, like you said, to just process it all and acknowledge it. So I feel like I got to a point where I don't want to say numb because it always hurt, but like we would get those emails like when patients would pass away. And I just got to a point where it was sad, but I was like, oh, okay.
It's just another email.
It was just another email.
Yeah.
Like, okay.
Yeah.
Not on to the next, but like,
yeah.
Just keep moving. Like I had to keep moving.
Right. You can't absorb every grief that you witness or you're not going to be okay.
No.
Yeah.
Right. And I mean, there were a few cases like when the death was like, it just came out of nowhere. Like patient was doing fine and just something went wrong. And then we do like case studies and they would bring like nursing, like all the staff just to like, I guess they just wanted us to feel like it wasn't your fault. Like, you did everything you could.
Yeah.
But they can't do that for every patient.
Right.
But that was helpful for those cases because there were times where like nursing felt like, oh my gosh, we missed something.
Yeah.
And that's why they ended up.
Especially if it was unexpected or like,
Yeah.
I can see that. So I think every healthcare provider needs a therapist.
Yeah, I think so. After talking to all my friends.
Yeah.
Just like we all need therapy.
We do.
And we can't help each other.
Yeah. We can understand each other,
right,
which is valuable. But I think even in understanding each other, it almost keeps us confined. It almost keeps us like in this kind of culty bubble of like, I get you, you get me, and that's it.
Yeah, it makes you feel like, oh, well, I don't need therapy.
Yeah.
Because I can just talk to my
Meanwhile, all these horrible coping mechanisms are just leaking over into every part of our life. And yeah. Anyways, is there anything else? Is there anything else you thought of or wanted to say or was on your mind when you were thinking about coming?
No, I don't know. I was just like reflecting about like the last 2 years and like where I'm at now. And I'm just like, oh, because I did get to a point where I like didn't want to be a nurse anymore.
Yeah.
Like when I hit like that year mark. And then now I'm like, oh, I feel like my nursing light has been rekindled, maybe. Yeah.
So you just needed like, a shift.
Yeah, like just a change in environment, I think. Because now I feel like, I'm not just a nurse. Because I feel like that's how the first 2 years were. Because I just felt like I was always at work. I didn't have time for you know, because when you're off, like not everyone's off the same days you're off.
Right.
So you're just doing things on your own. You're not spending time with your family.
Mm-hmm.
But now I'm like, oh, like I get to weekends, like I'm with my family or friends or boyfriend.
Mm-hmm.
I'm not missing stuff. And then I have time after work.
So you feel like you have a life outside of
outside
this
of the
sad
hospital.
place.
Right.
Yeah.
Yeah.
I like that.
Yeah. So I was scared to leave because I feel like there was a lot of, there's like judgment for leaving the hospital.
There's a lot of pride in hospital nursing.
Yeah.
Or like in acute care.
Right. They're like, oh, I've been a nurse here for like 20 years.
Yeah.
They're like, I don't get why people are leaving.
I'm like, yeah, but you're on your 6th divorce. Like, at what cost is this career for you? You know, like,
yeah.
And like no judgment. I'm on my second marriage, whatever. But like, I do. There is that kind of like allegiance to, or like, if you leave the bedside, you're gonna lose your skills.
Yes. That's what they would, they would say that to everyone who would go to outpatient.
Right.
They're just like, oh, you're going to lose your critical thinking skills and you're not going to do as much, you know. I was like, that's not true. Like, there's still a lot that goes on in the outpatient world.
Depression is not a skill I want to have anymore. Thank you.
Right.
I'm okay.
Yeah. So I was kind of nervous because eventually, like, people find out, you know, when you put your little 2-week notice. Yeah. So I was scared because for a while, like, I was going to do travel nursing because I was like, oh, if I'm unhappy, I might as well make more.
I can tell you, it doesn't feel.
No.
It doesn't.
No. And that's what I was like, my issue was like working in the hospital. So working in another hospital in a different state, just making more money is not going to make. It probably would have been, I would have been lonely and.
I'll tell you, like, I've been traveling, and I was a huge advocate for traveling, only in the sense that I feel like healthcare facilities should be accountable to actually paying their nurses.
Right. Yeah.
I'm an advocate in that way, but like, making more money doesn't fill in the gaps of like horrible working conditions, nurse-patient ratios, and just all
your mental well-being. Yeah.
It just doesn't. It just doesn't equate.
Exactly. Yeah. So I'm glad I realized that before I took a contract.
Yeah. I'm glad you did too.
Yeah. But yeah, I was nervous to tell them like, oh, I'm going to the outpatient because I knew I was going to get like some judgment or leaving peds for adults. Yeah.
I could see how there would be like a lot of pride.
Yeah. They'd be like, oh, you're leaving the kids. Like, yeah.
So I think the takeaway is do you, boo.
Yeah.
Do you. Like, do what you got to do. Yeah. For yourself.
Exactly.
This podcast was recorded in front of a live studio audience. My producer and his wife, and they weren't really that engaged, but you know, they were present. So we had an audience of 2 people. My husband was here for the first little while. Okay, I guess he got bored. No, he had somewhere to go. But anyways, yeah. That's it, you guys. I want to do like an intro song and an outro song. And maybe a middle song. Oh, no. I got one.
Oh. Yeah. You have it done already? Oh, wow. This feels so different.
Hurting my glasses.
Yeah.
Okay, shut it down, Charlie Brown.